In this lesson, we will continue with coping skills. Now that we've identified your symptoms, as well as the thoughts and sensations that contribute to them, it's time to find some new behavioral responses to replace the use of substances that we do not want to go back to. When it comes to coping with stress and anxiety symptoms that are related to trauma, there are two approaches that you can take: fight or flight. A flight response is the attempt to get away from a situation or avoiding the situation altogether in the first place. And a fight response is facing those feelings head-on and learning ways to reduce or manage your symptoms. As we learn in treatment for substance abuse, sometimes the best option is just to stay away from triggers. If being in a bar makes you want to have a drink, you should probably avoid hanging out at a bar. So when it comes to a symptom like anxiety, you can choose to stay away from things that will trigger your anxiety. You may want to avoid things like giving speeches in front of large audiences, shopping in very crowded stores, or driving in the city during rush hour. These are things that you can do to avoid triggering your anxiety. Most of these things are good options if you're already getting triggered, or if you're still learning how to cope. But eventually, you'll need to learn how to face them and learn how to fight. Fight. It is time to face our fears. Most of our trauma symptoms are connected to fear of something that's not even happening or ever going to happen. Most of our trauma symptoms are connected to a fear of something that's not even happening or even going to happen. At some point, you're going to want to start exposing yourself to these triggers and attempt to build up your resilience. We can decrease our symptoms and fears by mastery. This is a kind of trial and error experimentation that occurs as we gradually expose ourselves to things that make us anxious. We can force ourselves to cope with these things, dealing with the physical sensations, challenging the anxious thoughts, and tolerating the symptoms. The secondary result is that each time we face our fears, we increase our confidence. So each subsequent try, it gets a little bit easier. Now, every human will feel some fear when they're trying something new. That's fear that can actually help you get better. You'll learn that you can approach the situation, even with your nervousness, and still get that desired outcome. With a therapist or your group, develop a plan that'll work against your fear. Here are a few coping skills to get you started. One of them is square breathing. This is a tactic that the Navy SEALs use when they're under fire or any stressful panic situation. With square breathing, you breathe in for a 4-second count, hold your breath for a 4-second count, and breathe back out for a 4-second count, and then hold it again for a 4-second count. Another great skill when it comes to dealing with trauma symptoms is riding the wave. Emotions, like waves in the ocean, will build up to a peak and then break, quickly and steadily dropping you back down to smooth water. So the next time you're experiencing these symptoms, when you start to feel that rising panic feeling, try to just be the observer of it. Watch it as it rises up, as it builds and builds. Watch as it hits its peak. It can't go on forever, it never will. Then watch as it breaks and drops back down and realize that you're not in any kind of danger. This is a great skill to have in your tool belt. Thank you for choosing the Recovery Village. If you or a loved one are struggling with mental health or substance abuse and would like to find out more about the programs we offer, please reach out to us directly at 855-387-3291.